Let's face it, no one wants to look like droopy as they age. So today, we're going to try to stave off time like we're Tom Brady and teach you everything that you need to know about Botox.
First of all, who are you?
My name is Dr. Fongo, and I'm the medical director here at La Belle Vie Cosmetic. In my practice, I help my patients feel beautiful and confident through the utilization of non-invasive procedures such as Botox, lasers, peels, skincare, and fillers.
Awesome. So we are in good hands today. And so what is Botox?
Wow, yes. That's a loaded question because I get that from a lot of patients. So there are 3 different types of Botox that we use here. We have Botox, the brand name, then we have Xeomin, another brand, then we have Dysport. So Botox is a neuromodulator, which basically means that it helps relax muscles for a short period of time. So we inject it into specific muscles in order to relax it so that it doesn't form certain expressions, which leads to wrinkling on the skin. So that's the summary of what I would define Botox as.
Okay. Definitely didn't know that.
Botox is typically used in specific muscles, so we want to use it in areas of expression. When you raise your eyebrows up, you would typically get lines across for most people, but I don't have lines right now when I raise up because I've treated my forehead with a neurotoxin or Botox, Xeomin, or Dysport, which are other options you can choose from. The reason why we do these treatments is to prevent wrinkles from forming later on in life that increases the signs and expressions of aging. I tell my patients that earlier you get it, the sooner those wrinkles start disappearing.
Well, that is great information. So how long does Botox last?
About 3 to 4 months for most patients. Some of the things that can reduce the duration is if you work out a lot. So for my marathon runners or like, I don't know, people that work out a lot, it can last probably 2 months, if not shorter, because your body is metabolizing the product faster. I think of it as calories. So if I inject you today and you go out and you start running and sweating and all that stuff, then you are going to lose the product faster. So within the first 48 hours, I tell my patients no sweating, no hot yoga, no saunas, no facials right after my procedure, and no chiropractor appointments or massages, because you don't want to move the product to the wrong muscle and cause other issues. Issues are not real complications, I would say. If the product spreads to another muscle, it just relaxes that muscle as well. But there are certain muscles we don't want the product to spread to, like your eyelid muscle. You don't want it to spread there because then you won't be able to open up your eyes for probably 2 months. So those are one of the concerns that I try to express to my patients so that they can really utilize and make use of their post-care instructions after their procedure. Yeah.
And then what age should you get Botox?
The sooner the better. So there's the terminology or phrase baby Botox, or preventative Botox. You want to start probably in your 20s because the goal there is to stop and prevent the wrinkles before they even start. If you start in your 20s, you are going to get better outcomes later on in life because those wrinkles are being addressed and the muscle that forms the expression is going to atrophy faster. And atrophy means that the muscle gets smaller and smaller because you're not using it. It's like when you go to the gym, if you haven't done your biceps curls for 3 months, the muscle gets smaller. So the same thing with Botox, Xeomin, or Dysport when it's injected into specific muscles.
And lastly, why should men get Botox?
They're human, just like all of us. So they're going to get wrinkles, they all make expressions, and we're all really concerned about our appearances. Regardless of what people say about you should or should not care about your appearances, we are a society that's a little bit vain, and we have to be more accepting and receptive to enhancing our external appearances. It's not just the attire we're wearing, it's also our face and lifestyle and wellness, mindfulness, all those things. Internal and external beauty is important.
So then, also, does Botox hurt?
No. the bruising that might occur during the procedure is gone in about 30 minutes. So it's a fast procedure and almost painless. I would rate it out of 10 being the worst pain ever, probably a 1 or 2. I really truly believe that I'm just here to enhance what's external, but at the end of the day, the real work that our patients have to do is what they do at home. Whether it's self-care, self-esteem, addressing all of that, affirmations, that's what's really important, because I can do everything that we need to do here, but you go home and you have, you know, doubts about your appearances and you just don't feel good about who you are as a person. It doesn't matter what I did outside. The next thing is we're going to have you do some expressions.
Okay.
So we can find out the targeted area. So big frown for me, bring your brows together. Perfect. So yes, we're going to get that. Once that kicks in, you're not going to, when you frown, this is not going to move right here. Okay. Raise up for me. Perfect. You don't have a lot of forehead lines, but we're going to get all of these so that when you raise your brows up next time in about a week, it's not going to form any lines. So that's our goal for today. How does that sound?
Sounds good.
All right, big smile. All right. Sometimes I treat this area depending on how many lines they have, but I try to get my patients feedback in terms of if that's an area that builds character for you, if they have lines here, we might keep it, because which means for that patient, if they smile, there will be no expression here. So sometimes they have a hard time getting those areas treated because people will not really know when you're angry at them or when you're smiling from here, from your eyes. It's not going to affect your lower face because we're not injecting any muscles here. So during the procedure, I have you make the expressions so I can really see the muscle.
Oh, okay.
So just lean back and relax. All right, I'm going to move your face towards me. Big frown. Yes, and just keep it just like that. Good. Keep it. A little poke here. Poke here. Relax. How was that?
Interesting. Not bad though.
Alright, so now we're gonna get this muscle here. Squeeze your friends. Alright, relax. Good job.
Great.
Alright. You're doing so good. Good, relax. Let me know if at any point you feel like the world is getting smaller.
Yeah. No, I
Okay.
think it should be good.
Okay, just let me know.
Just a different sensation.
This shouldn't feel normal. Like
Okay.
you do this every day.
Alright.
Okay.
It's fair.
Because then I think about other drug activities.
Alright.
Shouldn't feel like you do this. Raise up for me.
Okay.
Right. So we're just gonna get these lines here.
Oh Lord.
Good, relax. I need to get more. Huh?
Yeah, it's sputtered out.
You can feel it going in.
Yeah.
Right, raise up. Thank you. Just keep that for me. So I'm just gonna go across. Men, I just go through horizontal, get all these lines for him. You're doing so good. Squeeze, squeeze, squeeze. And you're done. Breathe. Your expression. Do that. This last one, Ellen. And that's it. You're done. Look at that. You can breathe. Pace,
Okay.
you start noticing that the product will be reducing movement. Optimal results up to 10 or 14 days, but As soon as it starts kicking in, you'll notice, because your forehead is going to be smoother and it just looks great. And you're all done.
Alright.
You can look at the mirror. So the little bumps, 30 minutes, it should be gone. Okay. That's it. I have every patient come back in 2 weeks so we can reassess movement, because sometimes I need a little bit more just based on your muscle, and I try to fine-tune my treatment plans to make sure that we're really catering it specifically to that patient. Okay, and that's it. The frequency of getting Xeomin or Botox or Dysport, 3 to 4 months. If you come every 3 to 4 months, you can really target the areas to make sure that you don't get additional wrinkles or fine lines forming there. And we're all done today. How do you feel?
I feel beautiful.
So we just finished with Richard's Xeomin treatment today, which is another type of Botox, and what to expect after your procedure. No working out within the next 4 hours, no sweating, nothing that gets your heart rate going up, no chiropractor appointments, no saunas, no head lifts, whatever else, nothing. Don't touch your face, mainly because we don't want to lose the product and we don't want it to spread to the next muscles. It can take up to 7 days for the product to fully kick in and you start noticing reduction in movement in those muscles. But remember that it's temporary and it only lasts about 3 to 4 months for most people. And that's pretty much it. Nothing you need to do but just leave your face alone for the next 4 hours and relax.
Alright guys, so that was my first Botox treatment. Don't be afraid to get the Botox. It is beneficial to you not only from an aesthetic level, but it'll actually make you feel more confident and make you feel better about yourself. It was a pleasurable experience despite my facial expressions, and I would highly recommend it. If you are interested in this similar type of treatment, or if you are just a newbie like me, you can reach out to La Belle Vie via social media. With that, make sure to like and subscribe, and I'll catch you in the next video.